Both Republicans and Democrats are trying to make a big change to the president's health care law involving home health care. Chief National Correspondent Jim Angle tells us what's at stake.
House Republicans are proposing to roll back billions in administration cuts to home health care agencies, arguing that's exactly the wrong thing to cut because it's one of the most cost-effective forms of care. Oregon Representative Greg Walden's own parents got home health care.
I will tell you, it kept them out of the nursing home longer. It kept them out of readmittance to the emergency room. It made a huge difference in their quality of care because they could be home.
Just like Janet Connor's mother, Yvonne, in North Carolina, who got home health care when she contracted pneumonia.
I couldn't have done it without help, but it was over in about a week. She was well, so she didn't have to be hospitalized.
We've demonstrated that medical care in the home reduces emergency room visits and hospitalizations.
Dr. Fisher makes house calls to sick seniors and depends on home health care workers as a first line of defense.
For the cost of just one ER visit, you can pay for a year's worth of home visits by physicians and the healthcare teams that help us out.
Which is why Representative Walden is offering a bill to reverse $20 billion in cuts on top of $70 billion earlier ones, which he's co-sponsoring with Republican colleague Dr. Tom Price. Even the administration said the cuts would force 40% of home health care firms into the red just as the baby boomers retire. Walden says it could be 70% in rural Oregon.
That is not tolerable, that's not acceptable, and it's not smart.
Not acceptable to most senators either. 51 of them wrote the administration urging it to back off the cuts, including 36 key Democrats such as Chuck Schumer and Elizabeth Warren. But the administration made the cuts anyway. Democrats may have been worried about the narrative of the administration threatening 498,000 jobs of mostly women, while Democrats are trying to accuse Republicans of a war on women.
Gender issues are significant in home health care because most of the providers, the vast majority of providers, over 90%, are women, and the vast majority of the beneficiaries of services are also women.
This war on women hits the most vulnerable, making it a political liability. Now Democrats have to figure out how they'll vote on something they begged the administration not to do in the first place. Bret?
We'll follow this story. Jim, thank you.